Hi, Hawks. Welcome. We are going to continue our work on the exercise prescription PowerPoint. So give me just 1 second here to get that pulled up and shared with you. Here we go. So we've spent some time talking about, some of the benefits of exercise and kind of this disparity as it's associated with, the difference between what we believe to be true and how many people are actually participating in exercise. And we can appreciate that there is really a difference between, what is recommended and what people are actually doing. So I wanted to kind of point out to you this public health. Hang on, I'm getting my laser pointer out here. Public health initiative known as Healthy People 2020. And essentially this is a public health national objectives for improving health for all Americans. It is a pretty lengthy list of goals basically of what we want to accomplish as a country as it relates to improving health in general. So again, our general overall goal with this initiative is to attain higher quality, longer lives, decrease disease, disability, injury, premature death. Again, achieve health equity amongst all different groups. So again, really inclusive in regards to, including all ages, all, income levels, etc. Creating social and physical environments that promote good health, and then promoting quality of life, healthy development across all life stages. So again, this Healthy People initiative is put forward and they reassess it every 10 years in regards to trying to figure out how we can help people to become more active. How can we help people to become healthier, right? Is it an access thing? So, making physical activity more accessible. So Healthy People 2020 might do things like, help us to build more bike paths or bike trails, things like that. Or, access for affordable, healthy food options for different communities and things like that. So those are just a couple examples of parts of the initiative. But again, this is a government initiative that again kind of has these overarching goals, and then they're trying to do a lot of different things at the same time and in regards to improving health. And if I'm being honest, like, they don't really do a good job. If I were to survey you in the class, probably most of you have never even heard of this. And again, we think about, the percentage of people that are actually exercising and that are actually healthy. It's such a small number that we're not putting a lot of money into this, and we should be, because when we think about healthcare and you think about, the election and healthcare being such a huge issue, and healthcare for all and all this stuff, like, well, what if we could just be preventing some of these health issues in the first place? Then we wouldn't have to spend so much money on cardiovascular disease and lung cancer and those issues, because we know how to prevent those things. So if we put money into the other side of it, again, I'm getting a little political here. If we put money into the other side of it, then we would save a lot of money in the long run. So again, thinking about, government money and things like that, I won't go into it, but I think we can do better. So maybe you've heard of this initiative. It's known as Exercise is Medicine. It's a global health initiative managed by ACSM, which is the American College of Sports Medicine. Again, our goal is to promote exercise as a form of, or an alternative to, medication, right? So we think about the role of exercise as it relates to our overall health, disease prevention, and even treatment of disease. Wow, anyone can exercise, and it costs absolutely nothing to do so. It doesn't cost anything for you to walk outside. It doesn't cost anything for you to do some body weight exercises in your house, right? So thinking about, how we can sell exercise as a drug, right, as opposed to, some of these prescriptions and things like that that people are given. So again, ACSM, American College of Sports Medicine, but it's really a global organization, even though it is based in the United States. Again, what they want to achieve with this initiative is they want to encourage our physicians to actually prescribe exercise to people as opposed to just giving them a bunch of medicine, right? So the integration of exercise into healthcare can be used for both prevention and treatment of disease. Are we doing a good job? No, but we are trying to kind of get this going and get more healthcare providers on board with this. And again, a lot of you want to be in healthcare. You want to be physical therapists. You want to be occupational therapists, right? So what's your role? How can you integrate health? How can you integrate exercise into your treatment plan for your patients, right? So thinking about those issues, I think it is really, really important in terms of improving the overall health of our country. So what are the guidelines? What are we recommending as it relates to, general fitness? If I'm interested in just general health and fitness, ACSM, which we said was the American College of Sports Medicine, along with AHA, which is American Heart Association, has some guidelines for these various types of exercise. So we'll start with their aerobic fitness guidelines. Again, I hope you've learned this in multiple classes. But I think that speaks to the importance of these guidelines, is that we're covering them in a variety of settings, right? So what are the goals? We want to promote and maintain good health. We want people to maintain a physically active lifestyle. How do we do that? We want to do 30 minutes, 5 days a week, moderate intensity, or 20 minutes vigorous intensity 3 days per week. You could do some sort of, combination of those items. So you can, again, you could do 30 minutes moderate and 2 by 20 minutes vigorous or whatever. You can even break up that 30 minutes into 3 by 10 minutes per day. So again, I could walk my dog 10 minutes in the morning. I could walk 10 minutes over my lunch break, and I could walk my dog again 10 minutes at night. Something that simple can allow us to kind of accumulate a 30-minute recommendation. Okay. Adults should also do 2 days per week of resistance training, or, let's keep it even more broad. Any activities that are going to enhance muscular strength and endurance. So it can certainly be body weight exercise as well. And lastly, we know that there's a dose response relationship between physical activity and health. So the more physical activity you do, the greater the health benefits are. Okay. Other notes to think about when we think about, these recommendations. These recommendations are for adults aged 18 to 65. So we do have a separate set of recommendations for children, and we do have a separate set of recommendations for older adults. So again, this is just kind of hitting those middle age 18 to 65-year-olds. Okay. When we think about overall benefits, if we combine aerobic and strength training, this will allow us to improve body composition and metabolic rate. When we think about, the older population, we also want to include some balance and flexibility exercise into their training plans. And again, we'll talk about some of those special populations at the end of this unit. And again, when we think about this dose response relationship, if we exceed those minimum recommendations, this will elicit an even greater change or an even greater benefit from a health perspective. So again, we just talked about the guidelines for adults aged 18 to 64. As I mentioned, we do have some guidelines for children age 6 to 17, and then older adults that are 65 years and older. Adults with disabilities, we could talk about them. Also, we can look in more detail, and we will in fitness assessment next semester, at some special populations such as, individuals with lower back pain, or people with hypertension, or people with osteoarthritis, right? So how am I going to modify my exercise recommendations based on some of those kind of special scenarios, right? Children with disabilities, again, as an occupational therapist, would you be working with kids with disabilities? And so therefore, would you feel comfortable providing them with physical activity guidelines? Also pregnancy and postpartum women, what modifications do we need to make with those special situations? Again, here's a list of some of those special populations. And again, we'll try to hit most of those in fitness assessment next semester. But cancer, obesity, diabetes, renal disease, osteoporosis, arthritis, fibromyalgia, which is kind of like a general pain, and then cystic fibrosis. So again, we'll try to hit some of those next semester. So I want you to think about yourself as a personal trainer right now. And in order for us to begin exercise with a new client, we want to think about getting some medical clearance, right? And the reason we want to have medical clearance prior to beginning an exercise program with an individual is we want to reduce our risk from a liability standpoint. We also want to reduce the risk of the patient or of that client in regards to the likelihood of them having, something negative happen to them, right? So we want to make sure that exercise is healthy and safe for each individual. Okay, so before beginning an exercise program, men over the age of 45, women over the age of 55 should consider being evaluated to understand if they're high risk. So we can complete a medical evaluation. We can start with just a survey in regards to understanding, how risky is it for this person to participate in exercise, right? So the ACSM guidelines should be followed for each phase of the evaluation, and the physician should be consulted about the proposed exercise plan. Okay, do we ever do that in real life as a personal trainer? No, I've never seen that actually happen. But is that ideal? Yes, it is. We do want to complete this medical clearance protocol though, and I'll talk about that here in the next couple slides. So again, we think about these ACSM guidelines, a medical examination, an exercise test might not be necessary if the individual starts with moderate exercise and kind of gradually enters into a program. But people with symptoms of cardiopulmonary disease, we really want to be careful with these individuals, and we want to make sure that we're providing them the best care that we possibly can. Okay, so essentially what we want to do is we want to stratify people based on their risk of coronary artery disease. And so therefore we're looking at their risk for having some sort of cardiovascular episode. Okay, so here are the risk factors that we are going to consider, and then we'll talk about how we stratify people in the next slide. Okay, so some of the risk factors. So a plus means it counts as a positive risk factor. Then we have one negative, which means it's a negative risk factor, which is actually weird in my opinion, because like high HDL is a good thing. So you think of that as a positive, but it's really like backwards, if that makes sense. So anyway, let me get to that part. I'm getting ahead of myself here. So family history. I get a plus or I get a check mark in this category if I have a first degree male relative that has died from cardiovascular disease before the age of 55, or a mother or first degree female relative that has died before the age of 65 due to cardiovascular factors. Okay, so first degree relative is anybody like brother, sister, mom, dad, child. Okay, so those are your first degree relatives. Okay, so if my mom died at the age of 64 because she had a heart attack, I'm going to get a check mark. Okay, if my dad died at the age of 54 because he had a heart attack, then I get a check mark. You can only get one check mark per box. So let's say I had such bad luck that both of my parents give me check marks in this category. You would still only get one check mark. So you can only have one check for family history. Okay. If my aunt or uncle has died at the age of 49 or whatever due to cardiovascular factors, that does not count. It has to be that first degree relative in order to get that check mark in this category. Okay, cigarette smoking. So I'm a smoker. I quit smoking within the previous 6 months. So again, let's say I quit smoking 4 months ago. Well, I still get a check mark in this category. Okay, and we don't classify them based on like how much they smoke either. It's just, are you a smoker or are you not? Although we do know from research, like the more you smoke, the worse it is versus if you just smoke a little bit. But based on this classification, you're either a smoker or you're not. Okay, so if you're a smoker, check mark. Okay, hypertension, I have blood pressure greater than 140 over 90 on 2 separate occasions, or I'm on an anti hypertension medication. So if I'm on blood pressure meds or I have high blood pressure, without medication, then I get a check mark here. Okay. So if my blood pressure is like 142 over 75, I still get a check mark. So you only need to have one number high in order for it to count. And again, you can only get one total check mark. So maybe my blood pressure is 145 over 95 and I'm on medication, right? That's not 3 check marks. It's still just 1 check mark, okay? Dyslipidemia is our cholesterol levels. So you can see again, LDL, HDL standards, and then total cholesterol, or I'm on cholesterol lowering medication. So I want us to kind of review, and again, I would think you've covered this in another class, but I don't know that to be true, what LDL and HDL do. So HDL is like the healthy cholesterol, and HDL is going to help us to move fats from storage out, and so it'll allow us to carry that fat in the blood to like a muscle so that we can use it for a fuel. So like endurance athletes, for example, or people that burn a lot of fat are going to have high HDL levels, which means that they're really good at getting fat out of storage so that they can use it as a fuel. Okay, so we would desire the HDL to be high. LDL is the molecule that's going to help us to store fats. Okay, so if I have a high amount of LDL, that means that I'm consuming a lot of fats in my diet, and therefore I'm storing a lot of fats. Okay, so LDL is going to help us to store fats. Carries a fat molecule through the blood and to the fat cell so that we can store it. Total cholesterol, again, is the combination of LDL and HDL, and we want our total cholesterol to be lower than 200. So again, I can only get 1 check mark in this category if my LDL is high, if my HDL is too low, or if my total cholesterol is too high. Again, only 1 check mark there. Okay. Impaired fasting glucose. Sometimes I don't know this information and I don't know dyslipidemia. So if you don't know what those values are, then just kind of don't account for it, I guess. So don't include it as a part of your equation here. Okay. So impaired fasting glucose, if it's greater than 100 on 2 separate occasions. Obesity, again, I can quantify obesity in a variety of ways. I can look at BMI, I can look at waist to hip ratio as well, or I can look at waist girth. Again, just choose one of those items. I wouldn't include BMI if you're working with somebody who's super fit in the first place, like somebody who has a high amount of muscle mass, especially a lot of guys that have a high amount of muscle mass. Their BMIs might put them in the obese category, but they're not obese. So again, that's one thing to kind of keep in mind. And in that scenario, we'd be better off to look at waist girth or waist to hip ratio or even body fat percentage. But BMI gives us a good kind of starting point. Sedentary lifestyle, person is not meeting those minimum physical activity guidelines. So the 30 minutes, moderate intensity, 5 days a week, 2 days of resistance training each week as well. Okay. High HDL. So if your HDL is greater than 60, then you get to erase one of these check marks. Okay, so if the HDL is high enough, then we can erase one of these other positive risk factors. And then age, again, if I'm a male over the age of 45 or a female over the age of 55, I automatically get a check mark for that as well. Okay, so again, basically what we want to do is we want to analyze people based on all of this information and get a feel for what is their level of risk. So let's take a look at this. We have a lot of examples of this that we'll go over in class. So we'll work on some case study examples so we can kind of apply this information in Monday's class. Right. So first thing we want to do is we want to review their risk of cardiovascular risk factors. So do they smoke? Are they sedentary? What's their cholesterol? Do they have hypertension? So we're going to go through that list of items on the previous slide to determine how many positive risk factors they have. Okay. So that's the first step. So we want to review their medical history for risk factors. We also want to know if they have any known disease or signs and symptoms. Okay. So if they have a known disease, such as cardiovascular disease, peripheral vascular disease, cerebral vascular disease, COPD, asthma, cystic fibrosis, diabetes, type 1 or type 2. Okay, so type 1 diabetes counts. Renal disease, if they have any of these diseases, okay, they're automatically high risk. So you can skip over everything else and you can drop them down to high risk. Okay. If they do not have a known disease, then the next thing we want to know is, they have any signs or symptoms of cardiovascular, pulmonary, or metabolic disease. Here are the examples of signs and symptoms to look for. Pain or discomfort in the chest, neck, jaw, arms, or other areas that may indicate ischemia. Okay. If that is the case, send them to the doctor right away. Shortness of breath, dizziness, orthopenia, ankle edema, shortness of breath, dyspnea, palpitations of the heart, intermittent claudication, which is like intermittent pain in the ankles, heart murmur, unusual fatigue or shortness of breath with usual activities. That one's tricky because people that are out of shape, like I feel fatigued and short of breath, like walking up the stairs if I'm out of shape. So again, that one's not a great one. Anyway, if I have any of these symptoms, send them to the doctor right away and boom, they're high risk. Okay. So signs and symptoms or known cardiovascular disease, I automatically go down to high risk. If I have no disease, I have no signs or symptoms of disease, then next I want to look at the number of risk factors. So then I'm going to use that chart that we went over on the previous slide. And that chart is age, family history, cigarette smoking, sedentary lifestyle, obesity, etc. So you're going to look at how many risk factors they have to determine whether they're moderate risk or low risk. Okay, so if they have greater than 2 risk factors, they're moderate. If they have less than 2, then they're going to be low risk. Okay, so if I don't have signs or symptoms of disease, I'm automatically moderate or low risk. If I have every single one of these risk factors, I can still only be moderate, assuming that I don't have signs or symptoms and I don't have known disease. Okay. Again, we will go ahead and apply this in class on Monday. So do make sure that you have taken good notes on some of these sections here. So if I am high risk, I'm going to need medical clearance. So I want this person to go to the doctor to ensure that it's safe for them to begin physical activity. If I'm moderate risk, I need medical clearance only if I want to do vigorous intensity exercise. If I want to start with, like some nice moderate to low intensity exercise, then I'm good to go. Okay? If I'm low risk, I don't need any medical clearance. I can begin any type of exercise program that I want to. So again, when we think about this exercise prescription, again, it's important that we make sure that this person is cleared from a medical standpoint in order for us to ensure that it's safe for them to exercise. But our exercise prescription is going to involve 6 basic factors. We need to understand the mode, type of exercise, frequency, duration, intensity, weekly volume, and another component that we're now looking at as it relates to some of these ACSM guidelines. Not only is the exercise itself, but also am I taking some breaks from prolonged sitting, right? So we all live a pretty darn sedentary lifestyle outside of exercise, right? A lot of people have, sedentary jobs and things like that. So can I take some breaks from prolonged sitting in order for me to improve my health? Okay. So what are our primary goals as it relates to prescribing exercise to someone? Again, imagine yourself as a physical therapist, personal trainer, a strength and conditioning coach, all those things. Our primary goals should be to produce lifelong habits. So we want these people to not see exercise as a means to an end. So it's not just I want to get my ACL better, right? It's not just that I had this hip replacement and I want to be able to like walk without pain, although that is good. I also want to produce lifelong habits as it relates to exercise. We want to produce consistency. We want to progress towards healthy lifestyle. So you'll be surprised at how few people can actually do 30 minutes of moderate intensity exercise without stopping, right? So some people are going to really have to build up to that if they're really deconditioned. So again, we want to progress towards that healthy lifestyle. And then another important factor is to make sure we're choosing enjoyable exercises. And again, what's enjoyable to me versus what's enjoyable to maybe one of my clients might be very different. So it's our job to make sure we can expose them to a variety of types of exercise so that they can then, kind of decide for themselves what they like best. Okay. So general considerations for exercise prescription. Again, we want to include all the components of fitness. So we want to include aerobic exercise. muscular strength and or muscular endurance, flexibility training, body composition. And again, body composition will be kind of improved when you do regular aerobic exercise, strength training, and like eat decent. Okay, so body comp can be improved through a variety of factors, and then also maybe neuromotor fitness. And again, when we think about neuromotor fitness, we could think about how this applies to older individuals, right? So again, I want to think about maybe some of those balance issues and proprioception. So understanding body position will be important in sport. Okay, so again, we want to think about how neuromotor fitness might differ if I'm an older individual versus a younger person and those types of things. So it can mean a variety of things. Again, we want to include a plan where we are decreasing physical inactivity while also increasing physical activity. Okay, so keep in mind that exercise and physical activity are not mutually exclusive, right? So physical activity can mean, walking up the stairs versus taking the elevator, right? So as I decrease inactivity, I can increase my physical activity without actually doing a planned structured exercise, right? So, adding in some of those things, just being able to move around throughout your day to day. Common components of the exercise prescription can be helpful for reducing our risk of injury and complications. So again, we want to make sure we're including an appropriate warm up and cool down, as well as stretching exercises, and also gradually progressing our volume and intensity of the exercise plan, so that we're not putting our client or our patient at risk for additional injuries. Okay. Okay. What's the exercise mode that we should utilize? So we should use any rhythmic aerobic exercise involving large muscle groups if we're interested in improving that cardiorespiratory fitness. Okay. And what's the rate of progression that we should utilize? So we want to increase the time or duration of the exercise 5 to 10 minutes every 1 to 2 weeks over the first 4 weeks for the average adult. Older people or people that are really out of shape should progress more gradually. Even if I'm working with an athlete or someone who's super fit, I'm still going to follow the rate of progression rules. Okay. The rate of progression rules that I've followed for athletes is going to be known as the 10% rule. And I know our distance runners in the class know probably what this is, but essentially the 10% rule says that I shouldn't do more than 10% more each week. Okay, so for example, if I run 30 miles this week, I shouldn't do more than 33 next week, because 10% more than 30 is 3 miles. So I shouldn't do more than 33 miles than the following week. Okay, again, you can apply that in a variety of ways. Let's say I'm a swimmer or something along those lines, right? Maybe I want to look at the amount of time that I spend swimming. Maybe I spend 100 minutes swimming this week, and so next week I want to do 110 minutes, right? So following those rates of progression are really important in regards to injury prevention, in the long run. Okay. What's the best mode of exercise that we should use? Whatever is enjoyable for the person, right? So, it could be elliptical, could be running, could be walking, swimming, spin class, maybe it's a boot camp class, right? So again, thinking about what that individual enjoys doing is really important in determining what's the best mode of exercise, because at the end of the day, we want to encourage adherence and consistency. And if someone isn't enjoying exercise, they're not going to stick with it. They might stick with it for a little while, but they're going to stop doing it if they're not enjoying it. Okay. So we want to think about activities that are enjoyable, accessible, think about orthopedic limitations. So again, if I get pain in my knee when I run, well, maybe don't run, maybe try something else, right? Body mass, motor skill. So again, if I don't know how to swim, I'm probably not going to be super comfortable getting in the water to swim. Also, I'm not going to be able to swim for 30 minutes straight if that's not, an activity that I really know how to do. So we have to think about motor skill as well. Must try to find activities that are at least tolerable, but preferably we want to find activities that are enjoyable. What's the frequency? Again, aerobic exercise should be done 3 to 5 days per week, varying the intensity of that exercise. Again, if we want to see improvements, we can do more than 5 days a week. So improvements of cardiorespiratory fitness are going to begin, I guess, at frequencies more than 3 days per week. Plateau and improvement with exercises done more than 5 days per week. Again, a lot of people, endurance athletes, work out 7 days per week. So again, I think that that's kind of a lie. Like, you can continue to see improvements on this kind of linear curve to, a greater extent if I do more sessions per week. But for the average person, it seems like 5 days a week is good for their general health, if that's what I'm concerned with. If I'm concerned with sports performance, I probably need to do more than 5. Duration. So again, we got to think about, what's the goal of this person? If their goal is to just be healthy, then we want to try to get 30 minutes of moderate intensity exercise, or that 20 minutes 3 days a week of vigorous intensity exercise. Okay. If I'm interested in weight management or weight loss, I might need longer duration. So I might need to go 60 to 90 minutes per day for that moderate intensity, especially if your job or your normal lifestyle is sedentary. So if I sit at my desk all day long and the only kind of physical activity I get is when I go out and walk for 30 minutes or 60 minutes, I might need to do more than that in order to lose weight if that's something I'm interested in, right? Exercise bouts totaling 10 minutes per session may yield favorable adaptations for deconditioned individuals. So again, I might start at 10 minutes of cycling for somebody who's not very fit and really work my way up. We want to try to progress them towards that 30-minute marker. Okay. If we think about duration as it relates to a total week, 150 minutes of moderate intensity in 1 week is great, or 75 minutes of vigorous intensity in a week is great. I do think there's a lot of value in doing something every single day, especially if we look at metabolic changes. So your metabolic rate as it relates to these changes. My husband's a big endurance athlete, and well, I shouldn't say a big endurance athlete. He's done a lot of different endurance events. And like, so sometimes he'll do like, he won't work out at all during the week, but then he'll go on like a 4-hour bike ride on the weekend or something. And I'm just like, what? It'd be better if you just do a little bit each day. But he's like a total psycho. Like, he wants to do, like those long things. And so does that count as your 150 minutes per week? Yeah, but it's probably not ideal to do it all on one day, right? We should try to get something in every single day. So how do I know, we said they should do moderate intensity exercise, or maybe they could do vigorous intensity exercise. Well, like, how do we quantify that, or how do we classify exercise intensity? Okay, so we can think about this as it relates to heart rate zones. We can also look at metabolic equivalents, or METs. We can use RPE, which we've used in this class. And we could also look at percentage of VO2 max. So we can look at any of these classifications for quantifying their intensity levels. What do you think is the most common way for us to kind of monitor exercise intensity? Again, what way do you use to monitor your intensity? You just go in and say like, oh, I'm just going to put in a moderate effort. And so you probably use RPE. I would say that's probably the most common way to do so. We can certainly use heart rate zones, in a sport like running or swimming, we could use paces. So maybe I want to do 10 by 100 meters in the pool at 130 per 100 or something like that. That'd be a nice moderate intensity for me. Or, we could give our runners certain paces for, they want to run at 8-minute per mile pace, and that's a moderate intensity or whatever, right? So we can provide those particular types of intensity zones as well, although that's not listed. Minimal threshold for intensity varies depending on the initial fitness status of the individual. So again, if I'm super unfit to start with, I need to probably start at a lower intensity in order for me to kind of build my way up. So here you can understand the relationship between VO2 and heart rate, although you already know from the lab reports that you wrote, heart rate increases linearly in relationship to VO2 max. So therefore, you know, a lot of times we use heart rate as opposed to percentage of VO2 max, although VO2 max is substantially more accurate to use in comparison to heart rate. Okay. This kind of shows you the relationship between some of those variables that we talked about. So here you can look at percentage of heart rate max, percentage of VO2, we can look at RPE, and we can look at METs, okay? So RPE, I use a 1 to 10 scale because that makes more sense to me. 10 is the hardest that you could work, 1 is the easiest that you could work. But the original Borg scale is based on 6 to 20. And the reason it's set up that way is like, okay, 6 is the easiest I could work, 20 is the hardest I could work. If I choose 20, I can multiply it by 10 and that gives me 200, and that's approximately what your heart rate would be. Okay. If I choose 6, it's as easy as I could possibly be. If I multiply that by 10, that gives me 60, and that's probably what my resting heart rate is, right? So that's why the 6 to 20 scale exists. But again, a lot of times we modify it to a 1 to 10 scale for just, you know, for the average person. Again, so this is a nice chart for you to kind of take a look at when we're looking at these different ways in which to quantify intensity zones, right? Exercise volume, again, here we can see some of those health related measurements as it relates to the exercise volume. Again, we said that there's a dose response relationship. So the more I do, so we're looking at total calories burnt per week. The more calories I burn or the more exercise I do, the greater the potential improvement in each of these kind of health standards. So total triglycerides, blood pressure, body comp, and then HDL levels are all improved. And again, those are just a couple examples. We could certainly add in many other health variables that would improve kind of linearly as it relates to more calories expended or total exercise volume. Okay. Additionally, like people are dying less if we're fit. Does that make sense? So here you can see all-cause deaths for men and women based on fitness level, right? So if I have high fitness levels, I'm dying less in comparison to people with low fitness levels, right? Notice that it's more important for females actually than for males, right? For males, it's we're having higher death counts even with our high fitness level in comparison to females. So it's, I would say, almost more important for our females to do exercise in comparison to males. Okay. Check this out. Check out this cardiovascular disease death. You know, here you can see the difference between males and females, but all three substantially decrease their risk for dying from cardiovascular disease if I have a high fitness level. And in fact, we find that fitness is a more accurate indicator of mortality than obesity even, right? So what I'm trying to say is if I have a high fitness level, but I'm like obese, I still have a lower chance of dying in comparison to somebody who's skinny but doesn't exercise. So it's more important to be fit than it is to be skinny, right? I'm better off to be exercising regularly, even if I am staying overweight, than it is for me to be skinny but sedentary. And we'll talk more about that when we get to our body comp unit. Okay. Again, volume, when we think about the quantity, we can use pedometers or other types of tools. Again, lots of different watches will track our steps. So that's probably more common. We don't use a specific pedometer anymore. We use smart watches, Garmin watches, things like that. So it'll tell you how many steps you've taken. That can be a tool to promote physical activity and also approximate our exercise volume and steps. So we should have a goal to achieve 10,000 steps per day. But it appears that achieving a step count of 54 to 7,900 steps per day can help us to meet some recommended exercise targets, especially if I have a sedentary job. I might be able to walk or jog for 30 minutes in my day and have, you know, less than 10,000 steps in, but be meeting those exercise targets. Total exercise volume goals are approximately 1,000 calories per week of moderate intensity physical activity. Again, that's just for health standards. If I want to do something else like improve my sports performance or lose weight, then I probably am going to need to do substantially more than that. Again, we said not only do we want to promote exercise as this kind of planned portion of our day, we also want to increase physical activity as well. And we can do this through taking breaks and prolonged sitting. So research shows that sitting too long has a negative effect on somebody's health, even if they are regular exercisers, right? So even if I am going for a run every day, sitting all day long is not good, right? So research shows that the average American spends about 75% of their time sitting or lying down. Okay, so as few as 30 minutes of continuous sitting will increase insulin resistance, which puts us at a higher risk for diabetes. It can negatively affect lipid and carbohydrate metabolism, promotes fat storage, changes muscle fiber type, so it can change us from fast twitch to slow twitch for those intermediate fibers, also promotes inflammation as well. So what we need to do is every 30 minutes we need to get up and walk around. We need to go to the kitchen and get a glass of water, or we need to, go to the bathroom, or we need to, take a loop around your house, whatever it is. We need to get up and move around. As little as 2 minutes of low intensity activity can help us to kind of minimize these issues, right? So 30 minutes, so you're sitting for 30 minutes, get up and walk into the kitchen, get a glass of water, whatever, and come back in. And just by doing 2 minutes of low intensity something, that's going to help us to improve some of these these measures right here. Okay, so we think about programming an exercise program, I guess, for someone. We need to think about a lot of different factors. So we need to have a warm-up, dynamic stretching. We'll include a cardiovascular component. We should include resistance training, again, twice a week at least, flexibility training a couple times a week as well. They can include neuromotor activities such as, balance-related things for older individuals, and also kids would be good. A cool down and stretching, and then, what type of recreational activities are we including in our exercise prescription? So resistance training for general health. So we talked about those ACSM guidelines, 2 days per week, 10 exercises, 2 to 3 sets, 8 to 15 repetitions. The health related benefits of resistance training are well established, right? So resistance training is great for a lot of reasons as it relates to kind of our general health. It can help us improve body comp. It can help us to prevent type 2 diabetes. It can help us with blood pressure, metabolic syndrome, slows and prevents osteoporosis, can help us reduce pain of osteoarthritis, mental health benefits, and also can slow the physiological decline associated with aging. So a shit ton of reasons why we should be doing resistance training from a health perspective. Again, you've already seen this exact slide, right? So 2 days per week minimum, at least one set, probably 2 to 3 sets, 8 to 12 repetitions, 8 to 10 exercises, 2 to 3 minutes between the exercises. What type of exercise should I do? Free weights, machines, body weights. Again, talk about that in strength and conditioning as it relates to what exactly to include in this portion of your exercise program. Okay, muscular fitness for older individuals or deconditioned individuals. So older and deconditioned individuals should begin resistance training program with higher repetitions and a lower intensity, right? So keep the weight low, but the repetitions high. And again, we're going to then adapt and progress to a higher intensity scheme. Okay, so again, we want to start them at a very low intensity, especially if they need to learn the movements. We want to start them at a low intensity so that we can learn the movements appropriately. And then we'll progress that intensity as we move this person through a program. Again, what should we emphasize when we're working with deconditioned or older adults? Emphasis should be placed on full range of motion, controlling the movement, correct technique, and proper breathing as well. Here you go. This is the one thing I never do. Looking at flexibility. So joint range of motion or flexibility can be improved across all age groups. So again, we think about that all-inclusive piece. Everyone can see a positive benefit from an exercise stressor. It's just consistently doing that stressor in order to see some benefit. Okay, so joint range of motion and flexibility can be improved if we do at least 2 to 3 times per week for at least 3 to 4 weeks. What should we do? We should do 60 seconds of flexibility per joint. So that doesn't mean that you hold one single stretch for 60 seconds. You can do, like, for example, if I wanted to stretch my hamstrings, I can do, 2 or 3 sets of hamstring stretches for 10 to 30 seconds each stretch. Okay. I can also do P&F stretching. Remind me in class and oh shoot, I can't demonstrate any of this. P&F stretching is like the partner stretching. So somebody like pushes your leg up and then allows you to passively get more range of motion out of it. I'll give you guys a video for that because I can't demo that because I can't touch people, but P&F stretching is a nice way to do this. Again, you don't have to do that. The cons of P&F stretching is it does take some time because you're going to stretch your partner and then your partner needs to stretch you or whatever. So it can be kind of time consuming. I think it's a nice skill to have if you are a personal trainer, and certainly as an athletic trainer, we would want to have these skills as well so that we can help get our clients or our athletes stretched out if they have a tight XYZ. That might be an effective way to do so. We won't spend a lot of time talking about that in this class. Anyway, so I can do, a few different hamstring stretches to get myself to 60 seconds for that particular muscle group. Okay. Intensity of stretching to the point of tightness or slight discomfort is appropriate. Neuromotor exercise. So what is this? Neuromotor includes skills such as motor skills, balance, coordination, gait, agility, and proprioceptive training. Okay. So again, this will be important for older adults, also really important for kids too, as they're starting to learn, how to move their bodies and how to gain coordination. Sometimes called function fitness or functional fitness training. Again, it can help us with balance, agility, reduce risks of falls in our older individuals. For older individuals, we should do 2 to 3 days per week, 20 to 30 minutes per session for a total of 60 minutes per week. Again, this can be incorporated with other activities. So I can work on my balance and strength at the same time, right? So again, we can kind of incorporate this in with some of their resistance training, for example. Okay, special populations. So again, the special populations we are going to hit on include aging, pregnancy, obesity, and guidelines for kids as well. Let's start with older adults. So again, when we think about differences for older adults, their aerobic recommendations are the same. So we wanted to have them do moderate intensity, 30 minutes per session, 5 days a week, vigorous intensity, 20 minutes, 3 days per week. So either of those guidelines. Again, if I'm working with a deconditioned older individual, I always want to start with a low intensity and kind of work my way to moderate. What else? We should be doing strength training at least 2 days per week. I would even argue that older individuals should be doing more than that in order for them to maintain their muscle mass. Because of the muscle wasting that occurs with aging, we see muscle atrophy occurring relatively quickly. So older individuals maybe should do more than 2 days per week. Dose response relationship can be applied for our older individuals as well. So doing more is better than just kind of this bare minimum. Let's see what else. What else should I mention? Oh, you want to know something cool? So older individuals have the same capacity to gain strength as younger individuals. So like that's pretty awesome. Like you can improve your strength as you age by regularly completing resistance training. So that's nice. We want to maintain flexibility needed for daily activities. So again, we want to be able to maintain kind of our functional flexibility levels. And older individuals should stretch 10 minutes on 2 days per week. We also want to focus on fall prevention. So some of those neuromotor exercises so to reduce our risk of injury from falling. Again, older individuals that have medical conditions, Physical activity can be therapeutic if it's integrated into their prevention or treatment plan. So again, we think about physical therapy, OT, some of those rehab types of careers. Wow, what a great thing for you to be able to incorporate is some physical activity into their treatments for these people. Okay, I think I'll stop there because I want to talk about pregnancy in real life. So anyway, I hope you guys have a great day. We will pick up there in class and finish up this PowerPoint on Monday.